Welcome to everyone who's joined today. Thank you so much. My name is Brooke, and I'm happy to welcome you to the learning community on academic detailing, a new approach to reducing tertiary prevention. The session is scheduled for a total of 2 hours and will be interactive with 3 breakout sessions and an especially experienced speaker. Before introductions, here are just some brief reminders how to enjoy this virtual meeting. So here you can see some housekeeping notes. Be aware that we are recording today's meeting, so we ask that you keep your microphone muted when not speaking. If you have internet issues, try turning off your video camera or join by phone. If you're having trouble hearing, expand the audio icon to open the audio settings, and you can select a different speaker from the menu or adjust the volume. Now, you are strongly encouraged to use the engagement tools on Zoom freely throughout. You can use the chat and you can use the reactions. If you have any questions, you can raise your hand with the virtual raise hand button. And when our presenter opens the floor for questions or calls on you, you can raise your hand by clicking on reactions, selecting raise hand. Again, you can put those questions in the chat. Also be aware that certificates will be provided for attending today's session. And to receive yours, be sure to stay until the end and complete the evaluation, including your full name. Now, Kai, I'll hand it over to you and you can introduce our topic and speaker today.
All right. Thank you, Brooke. So welcome to today's presentation on academic detailing, reducing tertiary prevention, stigma. So the importance of this topic and why we chose this topic. Tertiary prevention strategies are essential components of a comprehensive AOD prevention and treatment continuum. These strategies focus on reducing morbidity, mortality, and system burden among individuals with established substance use disorders while supporting engagement, stabilization, and long-term recovery readiness. So that is why we chose today's topic. And now I'll be introducing Carol Furlong. Carol Furlong retired from the Elliot Health System in December of 2023 after a distinguished career in the new healthcare system, advancing the treatment of substance use disorder. She continues to consult for a number of organizations and associations to share her expertise and to continue to promote compassionate, patient-centered care. And with that, we'll go into
Okay, looks like Kai froze for a second. So I think we'll go into objectives.
I'll take over with the objective. Oh, there she is. Kai, do you want to do the objectives? You froze for a minute.
Oh no. All right. Am I still frozen?
No, you're good.
All right, let's try that again. So let's start from the top. Today's objectives. 1, identify fundamental steps of academic detailing. 2, describe how academic detailing affects conversation with healthcare staff. And 3, introduce a key message you want to leave with the person you're trying to engage on tertiary prevention. Why are we here? What can we do to help? And as far as format for today's session, this session will be interactive and we will utilize breakout rooms to gather perspectives and engaging meaningful discussions. If you have any questions throughout the presentation, please drop them in the chat. That being said, Carol, I'll turn it over to you.
All right. I can't see any the presentation, unfortunately, but I can just try to wing it, I guess. So let's talk about academic detailing in our topic. For those of you who aren't familiar, the term of tertiary prevention came from changes in format philosophy. It's not politically acceptable to talk about harm reduction. And so we're now using that term. And we know that harm reduction is a difficult process and a difficult concept to address with people outside of the substance use field. So many times we're presenting that topic to outsiders. We talk mostly about healthcare, presenting this to healthcare, but it could be political also. Having talked to recovery support organizations that have gone to aldermen's meetings or town meetings and talked about the importance, it can really be presented to a variety of populations and audiences. How did academic detailing start? Well, it started with pharmaceutical companies who would go to primary care doctors' offices, physicians' offices, and they were trying to sell their pharmaceutical products to them. Over time, it kind of got a bad reputation because it was so heavily marketing a technique. And they would bring gifts, they would bring food, and just want those doctors to sell, to prescribe those medications. Particularly when the opioid epidemic took place, people were very much aware that opioid medication had been, for lack of a better term, marketed as harmless. New Hampshire was #1 in the country for a while on opioid use and abuse and opioid fatalities. And when doctors had a conversation about that, the conversation revolved around, but we were told that this was a harmless medication, that there were no side effects, that it was not addictive. So pharmaceutical companies took a big hit from that, and pharmaceutical representation really decreased and had changes. So much so that laws were passed saying they could not bring gifts, for example. They could not really try to persuade the docs to prescribe medications. So it's much more subdued. What we know, though, is during those days, it was very successful in influencing medical professionals. And so an organization rose, it's now called NARCAD, and they developed academic detailing based primarily on those pharmaceutical rep methods, taking out some of the more troublesome aspects of it. So origins of academic detailing. Academic detailing originated as an interactive educational approach, outreach to physicians to provide unbiased, non-commercial, evidence-based information about medications and other therapeutic decisions with the goal of improving patient care. It's usually provided to clinicians one-on-one in their own offices, although we know large groups have been marketed in this way. The approach is based on the effective communication, behavior change, marketing approach that's used so powerfully by the pharmaceutical industry sales reps to increase the use of a company's products. So when we talk about academic detailing, we're talking about a way to approach whoever your audience is. It may be healthcare representatives, it may be nursing schools, it could be politicians, members of a community. So I'm going to refer to your audience and think about who it's more likely that you're going to be presenting this information to. We don't bring gifts. Anything you do that's going to remind people of the old pharmaceutical reps is not going to help you in any way. It's going to bring back that memory, and you're almost there's more skeptical of you if you do that, because the message is, when you do that, and this is one of the things we're actively not trying to do, you're not selling your product. So if you want to go and talk about your program, you're not selling your program. This is a different way of doing this. If you're trying to convince people in the community that recovery housing is a good idea, the focus is not on selling that product. It's a different viewpoint. The viewpoint, as we'll see, is more about helping your audience. So academic detailing, the difference between academic detailing and pharmaceutical sales. Academic detailing puts the approach solely in the service of providing practitioners, your audience, with neutral, rigorous information to optimize their clinical decision making. The focus is on them. In the past, when we have gone to present our programs to people, the focus has been on this is what we do. Now, the focus is how can we help them? It's not just promoting our business. So let me give you an example. The reason I'm so fond of academic detailing is about 7 or 8 years ago, the public health department in Manchester had an academic detailing grant, and they invited several people from the community to participate and train. And the first day of the 3-day program, I remember turning to one of my colleagues and saying, this is like pharmaceutical reps. And I was automatically turned off. By the end of the 3rd day, I got it. And I started using it. At the time, I was working at Elliot Hospital, and we had a grant to encourage our primary care providers to provide medication-assisted treatment. We had 3 people throughout the whole medical system that were willing to do that. But after this process that we're going to talk about today, within 6 months, we had 43 prescribers who were willing to do it. And it was not a heavy sell. Some of the reactions that people got, some of the negative anticipated reactions, was as a result of people who came into our emergency room. And typically they would want to sell their process. They want to sell their program. And they addressed it by saying, we want to be able to come into your emergency room and meet the patients while they are in the emergency room, and maybe even expand it to the whole hospital, and begin to provide services for them. So once they leave the hospital, they can then come to our recovery center. What's the issue with that? Again, it's selling my product to you with no knowledge of how that would impact your audience. One of the biggest drawbacks for this was the EMTALA laws that hospitals have to comply with. And that says, among many other things, that people who are not employees of the hospital or not privileged in the hospital cannot provide services. And they were actually saying that they wanted to provide those services. So that's against the law. But they hadn't done their research. They didn't know that. So their presentation was kind of dead in the water before they even got there. One of the things you have to look at, and we're going to talk about this under needs assessment, is know your audience. What do they do? What are their restrictions? How can you help them? Not just selling your program. So, how to begin? Think about this as a conversation, not a checklist. I'm going to say this and then I'm going to say that. No, it's a conversation. It's about developing a relationship. Nancy and I have talked about this many times, that really much of what we do is about developing relationships. So identify your best communication style. If you're planning on going and speaking to someone, how do you best communicate? Are you better in a group setting? Are you better in a one-on-one setting? I would recommend, if you want to try academic detailing, do it one-to-one first. Don't be afraid of making mistakes, but you're going to learn from it. So what's your communication style? What's the best social environment for you? Do you want to try to meet somebody at a conference and have a lunch with them? Do you want to go to their office? What's going to work for you and what's going to work for your audience? Which setting feels most comfortable to you? Now, not just to you, but which setting feels more comfortable to your audience? So there may be some advantages to meeting them in their office. It's their home territory. They're going to feel comfortable. On the other hand, they may get a lot of distractions. So you want to think about what's the best time, what's the best setting, where are they going to be more receptive to what you want to offer. And then you want to identify the best contact for you to start with. Who are the people that you know who may know a little bit about what you want to present? Those are going to be easier people to talk to because they already have an understanding. I certainly wouldn't recommend going to a political or a community event. And one of the things that's being discussed is a NIMBY approach, not in my backyard approach, not for your first one, because they're not necessarily going to want to hear what you have to say. And you need some practice to do this. So find someone that has some knowledge and is open to talking to you about this. If you're addressing a community, a hospital setting, or a primary care practice or nursing school, whoever you're talking to, if you can identify a champion, someone who may be open to this and who also may have some influence in that larger audience, those are the people you want to talk to first, because they will make the change for you. And I'll give you an example of that. As part of working at Elliot, I was the director of the drug court program for Hillsborough County. And when we started the program, we anticipated and we knew there was a lot of prejudice against this program throughout the greater community. So during the first graduation, we invited the senior staff of Elliot Hospital to it so that they could see the impact that drug court had on people's lives. And the very next day, because we invited people who had some credibility and who had seniority and some power, the very next day, they encouraged everybody in the hospital to go to a drug court graduation because they were so impacted by it themselves. That's what you want. You want to find people who are going to help you make an impact. Doesn't have to be a lot of people, but if you can choose one or two people who can do that, that's when you're going to be successful. Okay. What are the steps of academic detailing? The first one is the introduction. Now, some of these are very short steps. The introduction, for example, can be done over the phone. You may not even talk to the person you want to meet with. You may talk with their secretary. Hi, I'm Carol Furlong. I'm wondering if I could meet with so-and-so to talk about substance use issues in our community and how they may impact on you. Okay, you can say where you're from, but I'm wondering if we could talk and could we set up a time to do that? Very simple, pretty general. Okay. Be prepared. Be prepared for what you're going to say. And we're going to talk about key messages. We're going to talk about how to present it, but be prepared for the responses you may get. What if you say that, I'm Carol Furlong and I'd like to come and talk about substance use services in this community and how we may be able to help or find some of your answers, answer some of your needs. And they say, sorry, we just don't have the time right now. Okay, how do you respond to that? All right, I understand this is probably a busy season. Is there a better time in a couple of weeks where we could do that? Do you have a staff meeting? Maybe we could spend 5 or 10 minutes there. So be prepared for whatever the answer may be. You want to be accommodating to that. But be brief. You don't want people to get off the phone and say, "Oh my God, that woman wouldn't stop talking." Bad setup for your next meeting. Okay. You introduce yourself, your name, a brief background. Hi, I'm Carol Furlong. I'm a licensed clinical mental health counselor, currently working for this organization, and I'm wondering if I could just come in and talk to you about the current, or come in and talk to you about patients you may have that are experiencing SUD issues, whatever you want to address with them. Why are you calling? What are the things you want to find out about them? Remember, not about me. I'm not the focus. They're the focus. Your focus shifts to how can I help them with their issues? Now, if I'm in a recovery support center or a substance use department, or an organization, I am the president-elect of NAHATICA. I want to try to present what NAHATICA does. That's not my first momentum. I'm really trying to find out what their needs are and kind of thinking on my feet, but I want to prepare some of this too. How can my organization answer those problems for them? Okay. So you might say, I'd like to talk to you about substance use clients and any difficulties you have, or any areas of improvement you think we could make in the community. You may know that there are issues in your community with homeless people or syringe exchange programs, and I'd like to talk to you about what you think of that and see if you have any ideas on improving the situation. Whatever it is, you have to know a little bit about the organization so you can find the right way, the area of interest that will impact on them. Initially, you could talk about harm reduction. You could just talk about, one of the issues that we've seen a lot in the newspaper is about harm reduction concerns. I'd like to come in and find out what your concerns might be in that area. Be careful about talking about stigma. I want to come in and talk to you about reducing stigma. That can be part of your later conversation, but be careful about presenting that, because their initial response is, well, we don't stigmatize people. So you've kind of shut the door before you've gotten there. You're not there to convince them. You're there to help them. So remember that about everything else. The needs assessment. The needs assessment begins as soon as you make contact with them on that phone call. Are they busy? Do they say how incredibly busy they are? Most of them will, of course. And then you go to the office and you want to take note of how busy it is. Is the waiting room packed? Is it empty? What time of day is it? Does that have an impact on their practice? Are people on the phones busy? You can listen and see what kind of calls they're getting or making. You're getting a sense already about the operations of this organization. You look at the setting. Where is it? Is it in the community? Is it in the city? Is it in an outskirt? Get a sense of who their patients are. You need to understand the person that you're going to speak to, their practice, their agency, their beliefs, their attitudes, their issues, their concerns. All of those allow you to address all of the elements in your presentation. You're getting a sense already, just from being in there and having that first contact, with what some of their issues, problems, areas of help might be. And think about why you chose that person to meet with, because you already probably have a sense of some of that. See if you're right. The goals of need assessment: to understand more about the business or agency and attitudes towards your topic. Some of the people you speak with will have no idea about substance use. Excuse me. We worked with UNH, and we're working with students in their nursing program, and the nurses would come to us and we'd give them a tour of our substance use department and talk to them about the experiences that people entering treatment and early recovery would have. And by and large, the nurses, unless they had family members who had substance use experience or themselves were in recovery, had no idea. They have no training. And we all know the statistics are that medical doctors in medical school get an hour of training on substance use. So you may be the first person who is asking these questions and giving them answers. You want to obtain thoughtful participation by the person that you're meeting with. You want them to really think. So you're going to ask open-ended questions. How and why questions. What difficulties or successes have you had with clients that have said concerns? Not, do you see many substance use clients? If they say no, then you're going to have a hard time convincing them or presenting them with ways that you can be helpful. If they're convinced that they don't have any. If they say, oh yes, we do. We have a lot of clients. That is a closed-ended question, but it can lead to an open-ended question. Do you have any difficulties? Do you have successes? What leads to your successes? You want to find out. The focus is on them. What leads them to do the things they do, to have the attitudes that they have? Now, I say ask open-ended questions, but you'll note I purposely asked a closed-ended question that led to an open-ended question. Don't be afraid. If you find yourself asking questions that are given yes or no answers, all right, you're still getting information. Don't beat yourself up and say, oh, I gotta start this all over again. It's going to lead you to more questions. Find out more. You want as much information as you can. Then we get to the key messages. Now, before you go, before you even make that first contact, think about why you are choosing that particular person to contact. What is it about them? What is it about their practice that you want to impact on? And then, what's the key message you want to leave with them? What is the service that you're going to be able to provide to help them? You know, it kind of goes against our thinking, particularly in a healthcare field or certainly in the substance use field. We're used to talking about our clients and trying to get people to help our clients. We don't typically think about, and that's our priority. We typically don't think about how can I help this person who treats them. Clients are our first primary issue. So this is a different way of thinking. You have to understand and repeat to yourself that asking those questions is going to lead to better services for your clients. That's how you're going to help them. You're going to help our clients by helping these individuals. So the goal is of the key message is to bring about behavioral changes to improve client outcomes. It's the message you want to achieve. You don't necessarily have to say it overtly, but this is the message you want to receive and do something about. Key messages are a limited number of important points that are relevant, compelling, and succinct and are generally specific practice recommendations. And we're going to get to that as we talk more about this. What are the points you want your audience to remember? Key points are the lasting memories that you want them to maintain after you depart. You want them to say, if someone asks you, how did that meeting with, Carol Furlong, how did that go? You want them to say, you know what I learned? I learned that, and it may not have anything to do with me. It may not have anything to do with the organization I work with. But if they've learned something new that makes them more inquisitive, they're now talking about that with their staff. You know what I learned? Really, that leads to a whole other discussion. That's part of what we're trying to achieve. So think about what your key points might be. This agency can help your clients. We can help you in your practice, in your work. The key message might be, we're available to help if you have any questions. Can I set up a regular meeting? Collaboration and cooperation. If you ever have a client that you're not sure what resources to send them to, here's my card. Maybe you can meet with staff. I'd love to, you were surprised. I could say to them, for example, you were surprised at what I just told you. Do you think it would be helpful if I met with your staff in a staff meeting, 5 or 10 minutes to discuss some of these things? Maybe they have questions for me, and I'd love to be able to answer that for them. And you talk about it as this is something that's going to make it helpful for them. Okay. So let's get ready for our breakout. The question is, before I do that, does anybody have any questions? No. Okay. So the breakout question is, what types of key messaging would you like to introduce? We're going to briefly describe the messages you think would be most effective or impactful. Now, think about it in 2 ways. What are the key messages you typically give or want to give? And does this change your idea of what a key message would be? What are the key messages you'd like to give? What are the key messages you typically give? Let's talk about that.
Thank you so much, Carol. All right. We're 6 participants here. So would you like to break up into 2 groups of 3 or keep one bigger group? How do you feel about that, Carol?
You could just do one group, I think.
Okay. All right. Then we can stay here if you like. I'll send everyone into one room. That way, a few who are hosts maybe can stay. We could do it that way. And Carol, if you need to see, if you're not seeing the slides, I wanted to check on that. Are you able to see the presentation on the screen?
No.
Oh, okay. That's important. So if I sent you a little chat message, how you can change your view setting so that you can see it on the screen. You don't need it, but but it's easier to be able to see where we're going. There's a little box on the toolbar with lots of little windows, and instead of gallery, you can choose speaker. I don't know if you can find that. Maybe in the breakout room we can help help Carol find the view button on your Zoom toolbar. But if not, no worries. You're doing great.
No, I usually can find it.
Okay. No worries.
Oh,
So
I played around with it. I got it.
Yeah?
Good.
Okay. All right. So I'll send everyone to a breakout room. Enjoy the discussion. 10 minutes, right? We'll have the discussion. Perfect. everyone. Welcome back. Welcome back. Okay, looks like everyone is back. All right, Carol, all yours.
So I hope that was helpful, Nancy.
Mhm.
You have to think when we're talking about key messaging, what are your goals? What do you want to get to? What do you want to present? Nancy, do you mind if I use your example? Okay. So Nancy wants to work with drug courts and mental health courts, and she wants to, her end goal is to have people better understand the system and what resources are available. Yes, Nancy? No? Yes? No? Okay. That's what her key message is going to be. At the end of the conversation that she has with this person, it's going to be, you are trying to present this sequential stuff and people don't know anything about it. I agree, there's a great need for that. And one of the things we can do is work together. I can provide the experts in that field to present an educational opportunity. And there's a drug court conference every year. We could put that together if you wanted for that conference. And if there's continued interest, we could do other. There's her key message. That's what she wants them to do. So that will be the message she wants to leave. Pretty clear. Okay, let's move on to features and benefits. This is where we kind of start to get into the nitty-gritty, and you have to be able to explore different aspects of the key messaging. Features describe the product. Nancy's going to present or make available training that will talk about different issues that drug courts and mental health courts face. And she can give more detail than that. A benefit is how the feature meets the needs of the audience. It has a clear and direct impact. So when I say what's in it for me, what I mean is what's in it for your audience. Why should they do this? How will this make their job or their life easier? So providing this education to the drug court and mental health court systems, people will have a better understanding of the issues that these clients are facing. We may be able to convince judges to react differently. Not only will that help the clients, the drug court participants, but it might also have a greater impact on law enforcement, jails, and the community. Wow. Who could say no to that? You always connect the feature with the benefit. This is what we want to do. This is the action that we want to take, the product, and this is how it's going to benefit. It's the benefit that motivates people to change their opinions. If I can say, if we do A, B, C, D, and E can be accomplished, and as a result of that, your life will be easier, who would say no? They may have questions about it, and that's a good sign, and we'll get to that. I'll give you an example again. When I was trying to convince primary care providers to provide MAT services, I was prepared because many people in different practices had said, we don't want to do it. There was some stigma involved. We don't want those people coming into our office. They're not cooperative. They never show up for their appointments. Okay, why don't I come and talk to you about some of those things? And when I got to meet with the doctor, who I chose because he was in a position of authority, and I knew he had a great reputation, and he was very open to improvements. And I said, you're willing to provide medication-assisted treatment? Yes. I have a handful of people. Why don't you offer it to more? What if suddenly the hospital was inundated for a request for medication-assisted treatment, and you were asked to do that? What would your answer be? And he said, no, we can't. We don't have the time. Our nurses and the other doctors here don't have experience with it. We don't have the knowledge. We don't have the staff. Incredibly important information for me to have. Now I can address each one of those. Well, I happen to have a grant, and I can provide an extra nurse for you. But that nurse is not necessarily going to give the injections or hand out the medication. That nurse will do all of the care coordination efforts, so your nurses don't have to do that. Giving the injection is no different than any other injection. Your nurses do give injections, right? Yes. So I addressed the stigma a little bit. This patient is no different than any of your other patients, but I will give you a staff person to do that, a nurse, and we'll provide training. We'll come in and talk to your staffing about what we want to do, so that if they have any questions, they can feel better about it. Okay. There's the benefits of what we wanted to do. If your key message is, I understand you say you have a few substance use people. What I can do is that you can refer people to my agency. Okay. So what? How is that making their job easier? Now they have an extra task, and that they have to coordinate, make a referral, do whatever that process is. If they don't get a call back, what do they tell their client? Just, you can work with my agency, you can refer people to my agency is not helpful to them. It has to be a benefit to them. Okay. Next one. All right. Next slide. There we go. All right. So breakout number 2. It's important to plan ahead and anticipate potential challenges as well as your responses to these challenges. Think about this before you get into that meeting. You're gathering information, and you can't really know what those challenges might be until you find out more about what they tell you. But think about ahead of time what some of them could be. In the world of substance use, one of the biggest challenges is always stigma. Always. Even people who are in the field stigmatize. I was reminded of this. Nancy was talking in the first breakout, Nancy was talking about drug courts and mental health courts in the IEA process. And I didn't bring it up then, but there was a recent bill proposed, a House bill, to enable people with substance use issues to be involuntarily admitted to the state hospital or to a receiving facility. And it was voted down. And the biggest, the opponents of this bill were people in the substance use field. So as a result, and I think it was because they didn't understand the bill, but as a result, if you have a substance use issue and you want to harm yourself or others, you cannot be IEA'd. And that was because of stigma. So stigma is, when you're talking about substance use, you can count on it always being there. It's a lack of understanding. So barriers are potential obstacles to acceptance of your key messages. These are generally presented to you in the form of an objection. You know, talking about my experience with Matt. No, don't have the time. Don't have the time. Even though it takes no longer to inject medicine into a substance use individual than it does into a non-substance use individual. Don't have time for it. That's stigma. That's an expectation that those clients will be difficult. The enablers are parts of your message. They're the elements of the benefits and features that might address the concern. So you don't have the time. What we can do is I can give you a staff person that can help you work on care coordination so your nurse will have more time. That's part of what I can do. I'm going to enable you to move past the barrier and get this done. Get it done. So for an example, it could be, I might say one of my key messages might be, you know, staff might be more comfortable working with substance use patients after this training that I provide. And the barrier, the response I might get would, well, but we don't have time for training. We only have like 5 minutes. That's all we can do. Okay. My enabling response is a little training, or even maybe if you don't have time for training right now, getting to know me. I could talk to some of your staff. I could talk to the receptionist briefly. Maybe that would help. Maybe we could find ways to enable, to increase that time or the efficiency of that time together. So there's always, the enablers are part of the key messages. That's how you're going to get this done. Okay, next slide. Handling objections. We tend to think of objections as, oh my God, you know, it's a negative thing. I got to deal with all of these objections. Objections are actually a positive sign. That means they're listening. They're participating in the discussion. Just as you've had to think about if they give, if there's a barrier put up, how am I going to address it? Well, they have to do the same thing. As they're thinking, I really don't want this. What are the objections that I can put in place? But that means they're thinking about it. They're actually participating. They've had to think about all of the possibilities and what ones can they not meet or are not interested in meeting. So objections are a positive sign. It offers an opportunity to address their concerns. It further opens the dialogue. Oh, I understand you're worried that you might not have time, or I understand you're worried that it'll be too much of a drain. Let's talk about some ways that we can avoid that. Okay, now we're going on, having an increased discussion about it. Can also be a sign to better understand the situation and provide more information. Can you tell me how that would be a problem? Can you tell me in a typical day, for example, help me understand how that impacts on the staff? And they'll do that If they can't do it, then maybe it wasn't really an obstacle. But if they can, they're giving you more information so that you not only can learn how to address it, but you might think of other benefits, other features. Oh, well, we can do that for you also. Objections can be a lack of understanding, a fear that this means more work, a lack of recognition for a need for change, a misunderstanding of what was communicated, or a genuine disagreement. And all of those are opportunities for increased understanding, for more education, most importantly, for developing a relationship. So when you want to address those, you want to stay very positive. You can't be aggressive. You can't be argumentative. You are here to help them find solutions. How are you going to do that? Okay. Breakout 3. I'm going to put you on the spot again, Nance.
Stop the recording.
How might shifting the focus from selling an idea or service?
Can
So
you stop the
Did we
recording?
stop recording? Yeah.
Yeah.
How might shifting the focus from selling an idea? So steps for handling objections. We've actually probably already talked about some of these. Probe. You're going to ask questions to clarify what the objection is or their frustration. Tell me more about that. Restate the objection to show you're being attentive and you want to better understand. So you're saying you don't, see, I slipped. I don't want to say you are telling me necessarily, because that sounds like you might be saying, I don't really believe you, but you're telling me. Okay, so you're saying, you've told me now that you don't have time. You don't have time to do this. And this is because, and you give them the reasons they gave. Am I getting a clear picture? So you're clarifying. You're indicating to them that you are trying to follow this. This is important to you. Are you prepared to address the objection now, or do you need more information and preparation time? This can be a way to continue the conversation. They may have asked, well, if we do this, are you going to be available? If we do this, who are the experts that are going to work with us? Well, I don't necessarily have the names at that time. I don't know who would do the presentation, but I'll find out and I can give you a call and let you know. So you're taking this seriously, you're getting the information, and you're scheduling a follow-up conversation where you can kind of ask other questions. So this is who's going to be presenting. How's everything else been going? Have you been thinking about what we talked about? Is there anything else that you've thought about? It gives you another opportunity. And you respond to the objection using the tools that we've already described, the key messages, the features, the benefits, and the enablers. Yeah, that's a concern. Lack of time is a concern that almost everybody that I've talked to has had. You guys are overloaded. I get it. And that's part of why we want to do this. We want to make your job easier. We want to be able to help you be as efficient as possible because your time is of the essence. And then get confirmation that you address the objection successfully. So this was your concern. This is what we can do. Is that what you had in mind? And get them to say yes. Okay. Objections and categories. So these are all the different kinds of objections. Stops are a disagreement with your key message and a rejection of your call to action. No, we don't need anything right now. We're fine. Stalls, a deferral of a decision on your call to action. Yeah, That's interesting that you should say that, but I think I need more time to think about this. I probably want to talk to my staff before I agree to anything. On the fence, your audience is open to your position, but just not completely convinced. Yeah, it sounds like it's a good idea. I'm not sure it's going to work in my practice, though. And then there's indifference. The person who's, while they're listening to you, is, checking their books, looking up their calendar. Yeah, you get a lot of, yeah, okay. Those are all the different kinds of objections. The easiest ones are the disagreements. So stops are essentially no's. They're basically saying that, yeah, I don't agree with you, and we're not going to do it. I don't think that's going to help. Yeah, that sounds like a nice idea, but I think it's too time consuming. Those can be based on misunderstandings. They're not quite sure of the time or the effort or what you're presenting. Might be skepticism. They don't really think what you're saying is going to work. Some of that could be stigma. And they may have some valid concerns about staffing level. We just don't have the resources to do it. I don't see how that could work. Those are all opportunities, though, to address their concerns. You do that by asking clarifying questions. The misunderstandings and skepticism, those are the easiest to address because you can provide data that shows this work. You can provide examples that show it work. And the valid concerns, you acknowledge the concern and then you reframe it where the benefits outweigh the drawbacks. This is, I think you're giving me a good idea, but it's just the time. It just seems like it's going to take so much time to train people and to do this and to do that. Yep, you're right. It is going to take some time. But we can stretch this out. We can do 5 minutes. We can do it at staff meetings. We can talk more about it. We can do this as slowly as you need for this to be. Stalls are an avoidance of making a decision. It keeps you from knowing what they're really thinking, right? Find the barrier. There's a barrier in there somewhere. So ask them direct questions. What would make your decision easier? Not asking you to make a decision right now, but what would make your decision easier? And then give them some ways to do that. If they're on the fence, you need to understand what benefit is missing. They didn't hear all of the benefits, or maybe you didn't present all of the benefits. You are leaving the one that's going to clinch the deal. You haven't found it yet. What are the needs that are unfulfilled? And use open-ended questions to understand their concerns. Offer more features and benefits. They're on the fence because they're not seeing all of the benefits, or they're not seeing the most important benefit. They're going to learn about all the benefits as they go on. And then there's indifference. You need to ask questions. You need to help them see that there's a bigger need there. Acknowledge their point of view. And then, can I ask you some questions about this? What are the difficulties? When I was having a conversation about working with SUD clients, they just kept saying they're difficult patients. They're difficult patients. They cancel their appointment at the last minute. Now we have an opening that we couldn't fill. Or their appointment's at 1 o'clock and they show up at 4 o'clock. All of these different complaints that they could have of other people too. They're certainly not limited to substance use patients. But what I could say to them is, can I suggest, and I can help your staff work on some assertiveness skills? Because if a substance use client has a 1 o'clock appointment and they're showing up at 4, it's best that you not see them. It's to their benefit that you not see them. Because consequences and accountability are important aspects of substance use treatment. So I'm giving them a little bit of a boost trying to help them see some benefits and that will make them more efficient. And I'm willing to help them do that. Show them how their needs can be met. And if you don't have time, if you got to the point of the meeting, the end of the meeting, and you're running into these, can we schedule another time, another 5 minutes, just a 5-minute phone call to maybe address these? Or, why don't you think about this some more, and I'll come up with some ways to address your concerns that I haven't, and we can meet again to do that. That's harder for people to say no to when you're offering them more help. Okay, summary. Now, this shouldn't take long. Everything we've talked about, amazingly enough, are sometimes done in a 15-minute appointment. So the introduction is short. This is who I am. You want to find out more about them, how you can help them, and then the summary and closing minutes. It's an overview of the key message. So we've talked about ways that we can help, and these included A, B, C, and D. And they agree, the messages they agreed to, and a general sense of where the conversation ended. That's what we've concluded. You provide a brief review of the key messages, emphasizing those that they seem to have accepted. You don't have to go past through the ones that they've rejected. Don't remind them of that. Leave the focus on this is what we can do, and you've agreed that this would be a good idea. And then, do they have any questions about what was discussed? Do they have any concerns? And you use those last couple of minutes, maybe, to answer them. Or to say, that's a great question. Here's the answer. And the next time we meet, why don't I bring you more information about that? Again, see, there's another connection to the next time we meet. Okay. Okay, and then close. Next slide. So by this time, you should have a good understanding of what they're ready to accept. Ask the audience to implement some of the key messages. So we've talked about doing a little bit of training with your staff, and you've agreed that maybe coming to a staff meeting and presenting 5 minutes or 10 minutes of our program and what we're trying to work on is a good idea. Will you set up that meeting and have Mary at the front desk call me? Can we schedule that meeting now? Get them to implement. May just be having another future meeting. You want them to own that change. It's not just that you're providing a service. This is their decision. You've offered things. They're the ones who have agreed. Same thing as working with teenagers, right? If they think it's their decision, it's their decision. They're more likely to do it as opposed to, Mom said I have to. We discussed this, and I, the teenager, decided this is what I was going to do. Yeah, they could still back off, sure, because they're teenagers, but it's their decision. And you want to help them visualize how the change will be implemented. Can occur at a following meeting. Particularly if this is a 15-minute meeting, you've gone through a lot of material. And you've probably talked about ways that you can implement this. But some of that is for a follow-up discussion as they kind of review what they've discussed, thought about, we said we were going to do that. I don't think that's a good idea. I think we need to do it this way too. Good. That's great. And then at the end, it's great that you're willing to try these suggestions. I'll check with you next month. I think you're going to be, I'm hesitant to say you're going to be happy with this, but I think your staff and your patients are going to be happy with this. certainly more productive, certainly less frustrating than what you've been going through now, or whatever their emotion is that they said. You leave it on a positive note. And here's my card. Any questions? So it's not a plug necessarily, but I have to give credit to NARCAD. They're a great organization. They offer trainings. They offer nationwide collaborations. I was just on a call from agencies across the country. We had small breakout groups and talked about what are some of the struggles that we face. It was not just substance use. It was not even just healthcare. It was the process of how do we help people affect change in our particular through our particular perspective. But the discussions that we had were how do we help people make changes? It was. So, any last questions? Nancy, you ready to conquer the world now?
And you have a meeting coming up where you might be able to utilize some of these things.
Mm-hmm.
Yeah.
I thought it was helpful.
Mm-hmm.
Thank you.
And I know we had a small group, but it was good conversation.
Yeah.
If you have started to think about presentations that you make, and not this kind of presentation necessarily, but conversations that you have where
Right.
you want to make a change, you have an idea, and you now start to think about what's the key message that I want to leave this with.
Mm-hmm.
So many of us go into meetings, staff meetings, meetings with our bosses, or whatever, and we start practicing what we want to say, but we don't necessarily make it a priority to think about, well, what's the end message I want to get, and what's the best way to do that? That's what academic detailing is about. Okay. Well, thank you, all of you.
Thank you.
Thank you.
Thank you, Carol.
My pleasure.
Yeah, we're ready to close out then. I have some final announcements. We'll put them out there for everyone who will see this later as well. Thank you, Carol. That was an excellent presentation. Thank you for sharing all your experience with us. And thanks to everyone for being such a positive little group and so open and sharing.
Mm-hmm.
Now, if you'd like more information, if you'd like to contact Carol, here is the email, both for her and for NARCAD, up on the screen. And of course, you are welcome to visit nhthc.org to view past COP recordings and resources. And we don't want to forget getting our certificate today. I'm going to put that in the chat, although I think everybody has it here, possibly, but I'll put it there anyway. And here is the QR code as well. Remember to leave your full name in there to be sure that you get your certificate, and it's just a brief evaluation. And I think that's everything, right, Kai? Thank you so much, everyone, and have a wonderful day.
Thanks,
Thank you,
Kat.
everyone.
Thank you so much.
Bye. Thank you.
Bye-bye.